My research is on antimicrobial resistance in the environment, particularly how antibiotics exist in the environment as pollutants through the way that we use them and the way that they enter the environment, for example, through wastewater treatment plants. So antibiotics are environmental pollutants, essentially. And what we don't know is whether those antibiotics can increase levels of resistance in the environment. So my research has been focusing on determining the lowest concentrations of antibiotics that can increase resistance. So we've had a long-standing relationship with AstraZeneca, which started during my PhD. And since then, they also supported my research fellowship, and they've subsequently supported several other PhD students within the group. And what this has allowed us to do is to think about our research question in a different way and apply different techniques to try and generate research which is useful to industry, but also to policymakers. So it's really enabled us to take a different perspective on the whole scientific area, which has allowed us to develop our work really well. After that initial collaboration with AstraZeneca, that opened a lot of doors in terms of other groups that we started to interact and collaborate with. So the AMR Industry Alliance was one of them. So that's the largest international consortium of pharmaceutical companies interested in addressing the problem of antimicrobial resistance. On the policy side, we've got the Environment Agency, European Environment Agency, United Nations Environment Programme, and also Parliament through the All-Party Parliamentary Group on Antibiotics that we've done knowledge exchange or collaborated with or provided data to. And then even on the charity side, the British Society for Antimicrobial Chemotherapy, that initial collaboration and the work that we've done has enabled us to interact with all of these different groups.